I'm often asked, what is trauma? Trauma is a powerful emotional response to a distressing event such as war, an act of violence, an accident, the unexpected loss of a loved one, or even abuse. Trauma can continue to cause both emotional and physical symptoms for many, many years, even after that event has concluded. There are many common reactions to trauma. One is re-experiencing the trauma. What that means is trauma survivors may re-experience that traumatic event through thoughts, feelings, memories, or other means. Re-experiencing a trauma can be very distressing and may trigger uncomfortable emotions such as fear, anger, or sadness. Re-experiencing that trauma may happen in the context of nightmares, in flashbacks, which are uncontrollable vivid images or memories of that trauma. It may also manifest in distressing thoughts and feelings about the trauma, or emotional distress or physical responses after experiencing a trauma reminder. Another common reaction is avoidance of trauma reminders. Because reminders of trauma can be so distressing, it's common for survivors to use avoidance to control these reactions. Regretfully, we may often resort to drugs or alcohol to suppress those uncomfortable thoughts and emotions. We may use avoidance activities related to the trauma. We may use avoidance of people, places, or things related to that traumatic event. We may suppress thoughts related to the trauma, and we may ultimately avoid all conversations pertaining to that trauma. Another common reaction is negative thoughts or feelings. Negative thoughts or feelings may begin or worsen after experiencing a trauma. Some of these thoughts or feelings may not even seem to be related directly to the trauma at all. Excessive blame towards oneself or others related to the trauma, loss of interest in activities, feelings of isolation or disconnection from the surroundings, difficulty experiencing positive feelings, loss of memory related to the trauma, excessive negative thoughts about oneself or the world. Another common reaction to trauma is hyperarousal. Reactivity or a feeling of being on edge may begin to worsen after experiencing a trauma. This category includes a broad range of physical and psychological symptoms. For example, becoming irritable, quick to anger or aggressive, a heightened startle response, difficulty concentrating, frequently scanning the environment or watching for trauma reminders, difficulty sleeping, feelings of anxiety and related symptoms such as a racing heart rate, upset stomach, or headaches, and also risky or impulsive behaviors. That's why when one has experienced a trauma, it's really important to find a trauma-informed therapist or counselor. When a therapist has been authentically trauma trained, they're going to talk about safety from the very beginning of therapy. For instance, physical safety, emotional safety, and creating a safe environment where healing can occur. Also, a trauma-informed therapist is going to talk about self-care and boundaries and grounding and resourcing. A trauma-informed therapist is also going to approach your behavior as not being who you are, but rather being based on your history and that traumatic event. It's what's happened to you, not who you are. Also, a trauma-informed therapist is going to work on understanding your coping skills, how you survived your experiences, and help you build new, healthy coping skills. They are also going to move at a pace that you're comfortable with, collaborating with you all along the way and working to keep you within your window of tolerance of emotions.